We are learning new details about the death of Catherine O'Hara, the award-winning actress who starred in more than 100 roles in film and television, passed away late last month. A new report from the LA County Medical Examiner reveals that she died from pulmonary embolism, with rectal cancer listed as an underlying cause. For more, let's bring in ABC News medical correspondent Dr. Darien Sutton to talk about how these two are connected, how many Americans are dealing with these conditions. So, Dr. Sutton, explain to us a little bit what a pulmonary embolism is and how that could have possibly been connected to Catherine O'Hara's cancer.
Yes, well, Elizabeth, pulmonary embolisms is a common condition that we see in the emergency room for a variety of conditions. Cancer is one of those risk factors that you have to pay attention to. And to understand it, a pulmonary embolism, or a PE, is essentially when a blood clot forms in the body and travels to the lungs. Now, depending on the size and the location and how severe this symptom is or this condition is, it can ultimately be life-altering and life-ending. And so that's one of the reasons why we pay attention closely to this condition. Now, in terms of cancer, we understand that cancer cells can increase the risk of blood clot formation in the body and inevitably lead to this outcome, which is why we always pay close attention to those living with cancer because of this risk factor. It's so important to know the symptoms: shortness of breath, difficulty breathing, and chest pain. One or all of those symptoms can present with this condition.
So colorectal cancer, Dr. Sutton, is on the rise, especially among younger adults. What's behind that? What are some of the warning signs for this type of cancer?
You're absolutely right. Colorectal cancer rates have risen for young adults when you look specifically at the rate of new diagnosis between the years 2016 and 2022. And Elizabeth, that's in the setting of a national downtrend we've seen overall. But focus on those under the age of 50, the rate of colorectal cancer has increased by about 3% each year. Now, in terms of what's behind this, it doesn't seem to be any single factor. It's likely a combination of factors, including environment, exposure to chemicals, pesticides, pollution, consumption of ultra-processed foods. Researchers are continuing to investigate these causes to help spread awareness and to help young adults understand their risks to be able to get checked appropriately.
Well, given that and what you need to do to get checked, what are some of the screening options available for this? When should people get screened?
Well, colorectal cancer, we've actually decreased the age range when you get screened. It used to be around the age of 50, but now it's encouraged to start conversations around the age of 45. And Elizabeth, I encourage patients to start the conversation about screening in general around the age of 40. Now, colorectal cancer, often early symptoms or no symptoms at all. And so it's important to understand your risk factors. For example, if you have a family history or if you have a history of irritable bowel disease like Crohn's disease or other common irritable bowel diseases that many people might not be aware of, increases their risk of colorectal cancer. And then paying attention to the symptoms associated with late onset. That can include abdominal symptoms, bloating, constipation, diarrhea, sometimes bleeding. But I think it's really important to focus on your family history, your personal risk, so that you can talk to your doctor about getting screened. And the gold standard of screening is often a colonoscopy, but research and evidence and data have actually provided more options where you can get tested at home. But the importance of the conversation is so valuable, you have to start it first.
Sooner than later, as you say. Dr. Darien Sutton, always appreciate you, my friend. Thanks so much.